Lactation Education team, thank you all for joining us today. My name is Nayiri Gharibian. I'm a practicing Facey internist and I work in the Mission Hills office. And today we are going to talk about a very important women's health topic, menopause. And you know, there are often a lot of misconceptions and questions surrounding menopause. So we are hoping we can clear the air and maybe answer some of those questions today. And we are very fortunate to be joined today by one of our amazing Facey OBGYNs, Dr. Dafna Trites, who actually happens to be an expert in menopause. So Dr. Trites, would you like to say a few words before we get started?
Hi, everybody. So nice that you could join us today, and it's my honor and pleasure to be with Dr. Gharibian as well. And so this is a topic that's so near and dear to my heart. For so long, I've been really focusing on this as part of my GYN practice. It's such an important part of our healthcare for women. And I have, in my interest over the years, been able to also be certified by the North American Menopause Society as a menopause practitioner, so a certified menopause practitioner. And just a shout out to the North American Menopause Society website, which is menopause.org, where you can find the most up-to-date information about menopause for both patients and healthcare providers as well.
Fantastic. All right, with that, I think we are ready to start. Before we get into all the questions, we do want to just state that if you have any specific questions or specific concerns following this dialogue presentation, we encourage you to please discuss them directly with your primary care doctor or your personal OBGYN as they know you best. And with that, I think we're going to start with one of the most common questions, Dr. Trites, you probably get asked and I get asked by patients is, you know, what is menopause? How do I know I'm there?
Yeah, that is a question. So menopause is technically defined as a year of having absolutely no periods. And so once someone has arrived at that stage, they are technically considered menopausal. And there are a number of months to years beforehand, though, that people can have lots of different changes, different kinds of timing of their periods or different kinds of bleeding episodes and all of the other symptoms that go along with lots of hormonal changes. And that is called perimenopause. Perimenopause refers to those months to years before you actually get to a whole year of no bleeding, which would be actual menopause. And then once someone has reached menopause, we refer to it as being menopausal or postmenopausal. A lot of my patients actually think that menopause has a beginning and an end. And while we know that it really has a beginning, it actually doesn't have an end. So, you know, that's a big misperception. Most people will have some kinds of symptoms of hot flashes or night sweats or things like that. And over a few months to years, they may diminish, but they say about 30% of all 70-year-olds still have hot flashes. And when you're not taking any hormone therapy or any hormone replenishment, those symptoms can last for a long, long time. So just wanted to clarify that that there really is no end. There really, after you're menopausal, those changes will continue to be there.
All right, check. There is no end.
but there are ways that we can handle it well. So.
Okay, and with that, I think you touched on it, but what are some of the common symptoms? That's another question, you know. I do sometimes get patients, you know, walking in saying, Doc, I'm experiencing some changes, you know, is this menopause? You know, what are the common symptoms that women experience of menopause?
Yeah. There are so many symptoms. And well, just to kind of bring up or put it in context, we have about 3,600 different estrogen receptors in our bodies. And that's everywhere, from the outside of our skin to the inside of our bones and everywhere in between. And that includes our brain, our cardiovascular system, all of the joints and muscles, the bones. So it really does affect pretty much everything. And whereas, menopause is when our ovaries stop producing those hormones, estrogen and progesterone. When you don't have those hormones, you could experience effects from all those different areas. And so it's almost like a withdrawal effect of estrogen to have hot flashes and night sweats, which are really the most common, well-known symptoms of menopause. Other common and well-known symptoms would include drier skin, trouble sleeping, or being able to fall asleep, but waking up every few hours or in the middle of the night, not being able to get a full night's sleep anymore. Many women experience weight gain, and that's because it really plays into our metabolic health as well. And so it changes your metabolism. And some people do experience some joint pains and almost like bone rheumatic kind of pains. Some ladies will say that they have forgetfulness or kind of a foggy brain kind of sensation where they're there, but it's just like they can't really remember little things that they used to remember as well, no matter how much sleep they get. And then, of course, with time, many ladies will experience more pelvic complaints like vaginal dryness, burning, pain with intercourse, and those symptoms of the painful vaginal area happen actually a few years later. So it's not an immediate thing that happens. But as time goes by and we have the lack of those hormones, unfortunately, things start showing up that really are part of the whole package. And the other thing that I would say is that even before people get to a year of no periods and actual menopause, lots of changes are happening along the way where when we have fluctuations of those hormones, that causes more anxiety or depression, heart palpitations, headaches, and mood swings, and so many of the things that we treat with different supplements or medications, antidepressants, things like that. And I always say before or alongside making sure that everything else is okay, we really need to look at our female hormone levels, because if they're fluctuating a lot or if you're close to menopause, then some of those symptoms may be alleviated by just regulating your hormones and everything gets back in its place. So,
absolutely. Yeah. I think, a lot of women just sometimes unfortunately accept things the way they are and kind of carry on with themselves. But, that we're going to get into it now, but that there's things that we can do. So some women will say, why bother taking anything? I heard that hormones actually cause cancer. So can you speak to that as well?
Yeah, that's such a huge topic. We could spend, hours discussing all of that. But, the things that I talk to with my patients about are, a few different things. First of all, we need to address, sort of the timing of what we are treating. So if someone is having irregular periods and all of the perimenopausal changes or premenopausal changes, sometimes taking a little bit of progesterone cream, and people can buy that USP progesterone cream over the counter, because during that time we actually have an imbalance of the estrogen and progesterone, And we actually need a little bit more progesterone to regulate things and calm down any PMS symptoms, things like that. So progesterone cream is available over the counter. So you don't even need a prescription for that. You put a dime-sized amount on your forearm every night before you go to sleep. It can actually help you sleep a little bit better. And so for a while, that can be really, really helpful to minimize some of those symptoms that people get along the way to menopause. Also, over-the-counter supplements such as estrogen or menopausal support supplements can be really, really helpful around that time too. Some of them have products like black cohosh or ashwagandha or soy supplements. All of those are can be very helpful along the way. But at some point, for most ladies, they're going to get to the point where it doesn't work quite as well anymore, and they need something else because it's just not enough to replenish what's missing. So
then I guess then we can get into, the different ways to treat the menopausal symptoms.
Right, exactly. So, and I want to put out there that historically we've made this very, very complicated for some reason, where this is really, really just a very basic thing. It's kind of like if you had a thyroid hormone deficiency. And, as you know, many people have hypothyroidism. And so we replenish the thyroid hormone and then they're back to feeling good. And we alleviate a lot of the potential harms and bad things that can happen when you don't have your thyroid hormone. So I really have come to believe that this is really the same, just as the thyroid is a gland in our body. Our ovaries are glands that create hormones. And when they stop working, we will notice, we will feel the difference. And there are, pretty long-term consequences that happen because of that. So when we're talking about different treatments for menopause, you can go the route of treating all the different symptoms, like taking a sleeping pill or taking an antidepressant or using lubrication for vaginal dryness, basically treating all the different symptoms with different things that are available over the counter or even by prescription. But the main thing is that if you really think about it, it's just when you replenish that estrogen and progesterone, you're taking care of all of those things all together. And so for women who are able to just replenish those hormones safely, it really can kind of eliminate a lot of extra things that people would have to take just to function normally and to feel good. So I think it's definitely a choice for every woman as far as how they want to proceed and treat that. But one of the main things that I try to impart to my patients is that this is really a case of just hormone deficiency. And if we can just replenish what's missing and start early and continue, then it's safe, effective, and very, very protective for the long term as well.
Wonderful, wonderful. Great. What about the bioidentical hormone therapies? Sometimes we get asked about, from patients, like cutting edge stuff, bioidentical. Can you speak to some of those therapies too?
Absolutely. So bioidentical, the term, refers to a product that is exactly identical to our own natural either hormone or chemical that's made in our body. And it has been really quite a misnomer in the hormone world, in the female hormone world, for a long time now. So I want to go back to how this kind of started and became a thing, this bioidentical term. So a number of years ago in 2002, there was a big study called the WHI, or Women's Health Initiative study, that came out, and it basically had 30,000 women enrolled in this study. So it was big, big study. And from that study, they wanted to see if there was cardiovascular health benefit from taking hormone therapy, because until then, many women were taking hormone therapy, and they wanted to see if there was cardiovascular benefit. So half of the women were taking hormones, estrogen and progesterone, and half of the women weren't. And then there was a subset part of it where women who had had hysterectomies were taking estrogen alone. And from this study, they basically initially thought, oh, there's too much of an elevated risk of breast cancer. They kind of maxed out their guideline of where they were going to stop the study. So if they got to a certain number of people with breast cancer, they were going to stop the study. Well, after many years of looking back at the study, unfortunately, we found that that was probably not a great idea to stop the study at that point.
Yeah.
And at the time when it first came out, it gave the public the impression that hormone therapy was more risky than beneficial, and that we had to just all get off of our hormones. And that was a huge misinformation, disinformation, disservice to women at that time, because it was, sort of prematurely associated with an increased risk of breast cancer. And so a lot of women got it in their minds that it was dangerous, and then they went off of their hormones. And at the time, of course, you can imagine all these women going off the hormone therapy that they were on started to have hot flashes and depression and anxiety and night sweats, and they started suffering all over again. And so at the time, the industry of making, compounded hormones, that would be estrogen and progesterone, that are created by a pharmacist in their pharmacy, and concocted into a cream, a capsule, something that is made just for you. Somehow that became seen as safer for some reason, and they marketed themselves as being bioidentical. So when we talk about estrogens, estrogen actually is a umbrella term. And we have many different estrogens in our bodies. And there are a few that are the most prominent estrogens, one of which is estradiol, and another one is estriol. And there are a few other prominent ones. And so the compounding pharmacies created products. One of them was Tri-Est, and now we usually use Bi-Est, where they said, well, these components are exactly like your own natural hormones. And now we know, it's kind of a misnomer, because it is not like our complete natural hormone. It contains part of it, the part that is the most prevalent, but it's not like giving us back our, the same estrogen that we've made in our bodies. So over time, it has become a real big marketing term. And people associate bioidentical with safer, whereas we have many products on the market now that are bioidentical, such as estradiol patches, pills, sprays, gels, vaginal ring. You name it. We have like every way to provide estrogen back. And so whereas most women out there can, when they hear the term bioidentical hormones, they automatically think of going to a compounding pharmacy and having a product that's made just for you. A lot of people don't realize that we have bioidentical products that are safe, that have been FDA approved. that have gone through all of the hoops to be able to say, we know exactly how much you're going to absorb, and we know exactly the effect that this is going to have. And so I just want to put it out there that those products are equally as safe, actually even potentially more safe.
Mm-hmm.
So I don't know, Dr. Gharibian, if you have some patients who are on compounded therapies and things that they go sort of outside to menopause practitioners to get.
Sometimes, yeah, not too often, but naturopaths and providers like
Yes,
that. Yeah, yeah.
right. So what we found, and I prescribed those for many years actually, and what I would find is that women would do very well at the beginning, and then over time they would call back a few months later, or maybe
Mm-hmm.
a couple of weeks, a couple of years, and say, I don't know what happened. I was taking the same exact thing, but now my hot flashes are back, and now it's like I'm not taking anything. And what we found is that there is such a big fluctuation in the absorption of
Mm-hmm.
compounded therapies. And that's because, the amount in the product varies by the pharmacist who's making it, or the
Sure.
actual cream or the substrate that is used and how it's absorbed, the area in our body that we're putting the cream on, it
Yeah.
can vary. And so unfortunately, because the absorption is so variable,
Mm.
people have to get tested often. And those are ladies who have to go in every 3 to 6 months to get the blood tests or saliva
Right.
tests and kind of follow the numbers. And it's something that is maybe it's appropriate for a very small percentage of the population who
Mhm.
needs their specific dose. But really, for the vast majority of women, they do great with a lot of the FDA approved products that have specific tiered doses. And so there's no reason to necessarily need to get a compounded medication. And I also would say that compounded medication used to be covered by insurance quite a lot. And now it's
Mm.
absolutely not. I mean, most of my patients pay out of pocket for that, thinking that they're getting a safer product
Mm-hmm.
when it's not necessarily a safer product. And it's certainly a product that they can get, in other ways through their own regular pharmacies. Um,
Yeah.
so so there's just so much to it. There's been such a progression of um, different products, but also the thought process behind um,
Right.
what to use. And in terms of the question about bioidentical therapies, uh, there's an abundance of choices out there now that are really bioidentical, progesterone as well as estrogen, that can be utilized safely and effectively. So I hope that answers the
Yes.
question a bit.
And thank you for the history. It really does help put things into perspective, to realize, the history of where, this all came from, and how we are where we are essentially. So that's
Mhm.
absolutely fascinating. So
Yeah,
I think with that too, we should, maybe touch on, it's very common in medicine when we present therapies, we discuss the benefits and the risks. So, what are some of the benefits and the risks of the menopausal therapies that we offer?
yeah, such a good question. And of course, when I see women who come to my office initially, um, they are really inundated with so much information out there about
Yeah.
uh, um, is this going to cause cancer? Why am I feeling this way? So much conflicting information about what's safe and what's not. And so I encourage whoever is listening to our presentation today, that if you are uh, partnered with a primary care physician or a gynecologist or someone who can help you through this change, and it doesn't seem like they are on board with helping you, there are lots and lots of healthcare practitioners out there that are really well versed in this and can help guide you to make better decisions, and also help to put in perspective what your risks and your benefits are. So, and that being said, also, even though virtually every woman on the planet is going to go through menopause at some point. So we, unfortunately, I haven't met one yet that didn't go through it. And 51 years old, 51 and a half is the average age of menopause, but women can have it anywhere from sometimes mid to late 40s to mid to late 50s. So it's a big span of time that this can happen. And it really does have to do with making sure that you are healthy to begin with. So, it's a really tailored kind of situation. We try to take, the whole person into account, all of the other health issues that they have, from maybe they have high blood pressure, maybe they have a heart problem, maybe they've had a blood clot before, maybe they have liver issues. Those kind of issues are things that we take into account that may not be a safe situation to replenish our hormones. I also wanted to put out there that when we're in our fertile years and we're taking birth control pills or things for contraception, so birth control pills are really essentially the same hormones, estrogen and progesterone, together, usually, either separate or together, but really they're the same hormones, but they are in a much higher dose. So, right. So when we're in our fertile years, we need enough hormone to override our ovulatory cycle and to kind of calm all of that down and to prevent ovulation. So when we get to the point that we're in menopause, we actually need a way, way lower dose. And the normal doses of hormonal therapy that we offer these days are equivalent to about a fourth to an eighth of the dose of the lowest dose birth control pill. And it's funny how people are so sort of blasé about taking birth control pills in regards to risk of blood clot or risk of liver issues or things like that. But then when we get to menopause and we're taking a fourth to an eighth of that dose, then it's, there's this big, huge discussion about that. So it's really a funny kind of thing that we've gotten there. But again, that has to do with the information that we get from our environment and the news, the things that have happened, or even our families, our mothers and grandmothers, and the information that they had before is certainly not the same as the information that we have today. So you have to kind of put that all into perspective. But on the topic of the risks and the benefits, so as we were saying, we have those receptors everywhere. And so the benefits are vast, actually. Technically, hormone therapy is FDA approved for two things. One of them is the treatment of menopausal symptoms, so hot flashes and any other menopausal symptoms that someone is having. And the second one is for the prevention of osteoporosis. And we kind of forget how terrible osteoporosis really is. It is one of the most preventable situations ever. And so I also want to put a little plug in and to encourage women that when they do get to menopause, at the beginning of menopause, that they go and get a bone density test and get a baseline of where they're at, just to see. And a lot of times that will factor into their decision making about whether they want to replenish those hormones or not, or just kind of weigh that with different options of different therapies as well. So uh, bone protection is a huge bonus of menopause or of menopausal therapy. We are going to show a slide actually about osteoporosis. That slide is an amazing testament to how debilitating it can be if you do have a fracture. And it said, I'm sure you've let your patients know too, that if someone, let's say, is 70 years old and sustains a fracture, they have almost a 50% mortality rate. That means that they may die of not only just the fracture, but all of the complications that happens after that.
Yes.
So if we can do anything to prevent that, that's
absolutely
huge.
Yeah,
that is huge. I'm
yes,
sure you
and
see
that
so many
it's a
people
point
like
that I
that.
think we forget, sometimes with regards to bone density and osteoporosis, and that hormone replacement therapy is such a huge role in that as well. So I think bottom line is to get the message out to get yourself a physician who is a good advocate for you, and connects with you and can help you if you're finding yourself in this situation of menopause and all the symptoms and all the issues that are coming with it. So right.
And I wanted to also just put out there that the question always is about the breast cancer risk with taking hormone therapy. And what we found is that when women start hormone therapy early on, and from that WHI study, we found that there's a window, like a window of opportunity. So if you initiate hormone therapy within the first 10 years of menopause, then you get major benefits and very rare risk. If you wait after that time, then our receptors change and you don't respond to those hormone therapies the same. And then the risk of blood clot, heart attack, breast cancer, those can be actually more than if you started early. And whereas before we were thinking, well, maybe you should just take hormone therapy for 5 years and then stop, or after 65, you shouldn't take it anymore. Those recommendations have now been disposed of. And we know that women who start early and replenish those hormones right away and continue, they have very rare risk of those complications. In terms of breast cancer, even in the WHI study where they stopped the study because of that breast cancer risk, the risk of women who are taking estrogen and progesterone together were an elevated risk of 9 people out of 10,000. And so it was a very low number.
Right. Very low.
Very low. And out of those women, more women who, shall I say, the women who actually did get breast cancer, actually more of them survived because they had a better type of breast cancer than the women who were not on hormone therapy. And the other part of the study showed that women who were taking estrogen alone, who had a hysterectomy so that they didn't need the progesterone, they actually had a 30% decline in breast cancer. So it was an amazing thing to see that they actually had a lower risk of breast cancer, not an elevated risk. And the other amazing thing that we found over the years is that women who take hormone replacement therapy have a 30% lower rate of dying from any cause than women who don't take it. And that's because many more women die of cardiovascular disease all over the world, probably 10 times more than from breast cancer. And so replenishing the hormones and protecting the cardiovascular system does a whole lot more to improve quality of life and to elongate life than to not take it.
I think it's because they're happier and more fulfilled or something.
Well, they're
I
getting
guess
more
with,
sleep. They're
yeah,
getting
they get more rest
better
and sleep.
sex, better, you know.
Um, with that too, you touched on it a little bit, but is there time or age limit to hormone therapy? People wonder about that too. Like you said, you hit 65, do you stop it? What would you say about that?
So there's really no time or age limit as long as you start within the first few years of menopause and then just continue. And I've had women who are in their 80s now who are still taking it, who are adamant that they will continue no matter what. And I must say, some of the many physicians get these letters from the insurance companies or from Medicare that warn, like a warning, oh, your
Yeah.
patient is over 65. And I've noticed that the wording on those recommendations has changed, thankfully. So now they're saying, please evaluate whether your patient has been on this, for a long time, or if they have just initiated it, it may not be appropriate. So thankfully,
Right,
the
right.
warnings are changing.
I get those things.
Right. And if you don't read it carefully,
Yes.
you would think, oh, this is an alert. My patient's over 65 and I should take her off of her hormones.
Yeah.
And I've seen, all those ladies come to me. So, and I distinctly remember, I mean, I've had so many, but one of them that was so kind of emblazoned in my memory is a woman who came in with this thing hanging off of her neck, like a necklace, and it was this device of some sort, and I couldn't figure out what this device was. And it turned out to be a fan, like a personal fan.
Oh my gosh.
And she said, well, I had to get it. I have them in every color. They match every outfit.
Oh
And,
my goodness.
and I had to start because my physician told me I'm too old to take hormone therapy and he just wouldn't refill it anymore. And she was about 60 years old at the time.
Oh,
And her life completely changed. She couldn't sleep in the same bed as her husband because she was having too many hot flashes and night sweats, and she couldn't have intercourse anymore. She felt tired and foggy brain all the time, and she had to have this fan with her all the time. So, kind of getting her back on her feet with this hormone replacement was life changing. And I think for so
yeah.
many women, it is just like that. So unfortunately, not everybody is up to speed with the most current recommendations. And and on that note, I would always tell my patients too, if you are, um, partnering with another physician or healthcare provider that is telling you one thing and you're thinking another, please refer to the menopause.org website, because it's for everyone, and we can
Yeah.
all learn from the most updated recommendations and, be safe and careful about it, but also, you know, be doing things that are in line with the science of what we see
Yeah,
now.
absolutely. Well, that patient is lucky she met you, so that's a good happy ending story.
Yes, for sure.
Um, with regards to the medications, Dr. Trites, there can be an issue sometimes of insurance coverage. So what can a patient do if the insurance doesn't cover their medication?
Yeah, we see this um, really, really so often, as we years ago, when the patients were taking a lot of compounded hormone therapies, the insurance company covered that a lot, and now they don't cover it at all. And every day it's a different story. I mean, literally, they change their formularies all the time, and it's just based on the contracts that they have with different companies, unfortunately.
Right.
However, what I do know is that every insurance company has to cover menopausal therapy. They always cover some product, It may be a different product than the one that you were prescribed, but they definitely cover something that is equivalent to it. So one of the best ways that I found is to have patients contact their insurance company
Mhm.
and have them give them a list of everything that is covered for hormone therapy for menopause. And then when you see the doctor or your healthcare provider, you can show them the list and you can kind of be more up to speed, so that it really helps us to be able to prescribe something that we know
Yeah.
that someone's actually going to be able to go get when they go home. So, and then also sometimes they require that you try their preferred um, uh, product first, and then and if it doesn't work out, then you can try a different product. So it's just kind of a journey sometimes to get to the specific product that's covered by insurance. Did I cut out there?
Nope, you're good.
Okay.
Yeah, that's a great idea with the lists. I mean, vouching for primary care doctors, we actually really love lists because when you have a limited amount of time with a patient, and this is possibly one topic out of 10 that you want to discuss, having a list that you've already done some research with your insurance plan makes us very happy.
Mhm.
So thank you for that
Yes, it
tip.
does. Yeah, of course.
Um, I do also just want to add, I think we're getting to our end here, but friendly primary care doctor plug-in, and with regards to preventative care. Sometimes we get asked, now that I'm in menopause, I haven't had a period in years. Do I still need to continue my annual exams, my pap smears, my mammograms? And the answer is yes, very much so. And in fact, as Dr. Trites highlighted earlier to me, your risk for a lot of cancers, including breast cancer and some gynecologic cancers, actually goes up with age. So you don't want to stop your screening. So if you have any questions with regards to screening, please discuss with your PCPs and your OBGYNs. So
Right.
do you have
Absolutely. And I
any,
always, yeah. I always think also that it's a great time to discuss all of those hormonal changes and therapies and the most up-to-date recommendations. So if you are checking in every year, uh, and basically, especially women who are on hormone therapy should be checking in every year to make sure that you're still healthy and an appropriate candidate for using the medication. But during those visits, there is so much to be discussed, and so it's not only to evaluate for new changes, but also to update with the most latest, greatest information too.
Absolutely. Well, with that, I think we've answered plenty of questions. This has been such an informative dialogue. Thank you so much, Dr. Trites. Thank you, everyone else, for joining us. And we hope that you enjoyed this as much as we enjoyed making it for you all, and hope to see you all until next time.
Yes,
all right.
We did. Thank you.
Bye.
Honor and pleasure. Bye.
Bye.